Hi, I'm Dr. Elizabeth Langer, and I would like to share with you our second acupressure point in a series of 7 acupressure points to calm your anxious child. And today I'd like to talk about one of my favorite points. It's a super point. It's called Pericardium 6. And this is especially good if your child or you is experiencing anxiety that causes an upset tummy or hyperventilation, like having trouble breathing or having pressure on the chest. This is also the point. It's going to look very familiar that they tell you if you're pregnant and you're having morning sickness, they get them those C-bands. So that's basically what it does essentially. And I'm going to show you real quick how to find it. There's 2 different ways you can find pericardium 6. The first way is you take your index finger, your middle finger, and your ring finger, and you put it on the inside of your child's wrist crease. Actually, on side of your wrist crease. You want to use your child's fingers for their own wrist. So you go like this, and it's not quite at the edge of the ring finger. It's just right inside. You just almost like slide up just a little bit, and that's where it is. Or if you want to be more exact, but this can be more difficult if you have an anxious child, because you want to get the measurements kind of right. You take your child's thumb and you go 1, 2. And then it's between these 2 tendons, and if your child's wiggling their fingers, you'll be able to find it. You can try it on yourself first. Now, again, when you're doing it on your anxious child, you want to really try and use this ring finger, because you're not going to want to press hard at all. I mean, you can go in a circular motion if that feels good. Try clockwise for this one, just trust me. But you might like a lot of pressure, and you can just dig into it if you like, but it's a sensitive spot. Like, I don't even like a lot of pressure on the inside of my wrist, and my daughter hates it. So if that happens with your child, don't force it. Just say, okay, moving on. There's plenty others, and we'll go over them soon. All right, well, have a good one, and please reach out to me if you have any questions, and if you know of somebody who this might help, if they're struggling with anxiety or their child is struggling with anxiety, please give it a share. All right, take care.